Hi, my name is Michelle McCloskey, and I'm a freshman in the School of Nursing at the University of Michigan. My clinical placement is at Heartland Healthcare Center, and I'm going to present one of my patients to you. The patient interviewed is a 69-year-old African American male. He is a veteran and is divorced with one living daughter. Upon taking vitals, pulse rate was found to be 61, blood pressure was 134/75, and respiratory rate was 20 breaths per minute. He is up to date on all immunizations and has received a flu shot. In addition, the patient is allergic to cortisone. The patient is seeking health care at Heartland Medical Center on behalf of his Huntington's disease. He also currently suffers from schizophrenia, hypertension, hyperlipidemia, depression, urine and bowel incontinence, bipolar disease, post-traumatic stress disorder, anemia, and cataracts. To move around, the patient uses a wheelchair and lifts himself in and out of the wheelchair using his upper body strength. He is currently taking omeprazole twice a day, 1 milligram of folic acid, 100 milligrams of thiamine, 5 milligrams of Ritalin, as well as other medications for his anxiety. After assessing his psychosocial data, it was found that he is not in contact with his ex-wife. His son was killed, and one of his daughters was diagnosed with Huntington's disease 4 years ago and has since died. Since Huntington's disease is an inherited disease, the patient was alerted of his own diagnosis after his daughter's diagnosis. The death of his children causes him great stress, especially the unknown specifics of his son's death. He does have one living daughter who he maintains contact with. During the collection of subjective focused history data, I focused on two systems that are of high priority for the patient. Beginning with the musculoskeletal exam, the patient voiced that his Huntington's disease, chorea, has impacted his movement. Huntington's disease, chorea, impairs the patient's involuntary mobility with abrupt and irregular movements. The patient's family history consisted of his daughter's diagnosis of Huntington's disease. The patient stated that he has slight loss of mobility in his fingers and greater loss of mobility in his toes. Upon musculoskeletal examination, muscle mass was found to be greater in the upper body. TMJ, neck and shoulder range of motion were all adequate. When assessing muscle strength, deltoids, biceps, triceps, and wrists were all 5 out of 5. Finger strength was 4 out of 5, with the omission of the right pointer finger that was damaged during combat. This finger has very little mobility and only a 2 out of 5 for strength. Due to the loss of strength in the right pointer finger grasp in both of the patient's hands was not equal bilaterally. Hip abductors and adductors were weak with a 2 out of 5 for strength, whereas hamstrings and quadriceps held slightly more strength, giving them a 3 out of 5. Knee flexion and extension was adequate and equal bilaterally. The second system I examined was the neurological system and mental status. The patient complained of changes in his ability to perform daily living activities. He explained that he can get around but requires the assistance of a wheelchair or walker, preventing him from being completely mobile. The patient stated that he experienced vision difficulties and depression, but denied speech difficulties. Running through the cranial nerves, I found olfactory intact. There were abnormalities in the patient's eyes with apparent cataracts. Pupils were equal and measured a size 4, and the patient responded to a sensitive touch on his face and extremities. Masseter muscle strength was also strong, indicating an intact trigeminal nerve. Facial was intact, and since the patient was able to hear whispers equally in both ears, vestibulocochlear was intact. Cranial nerves glossopharyngeal, vagus, spinal accessory, and hypoglossal were all tested and shown to be intact. I performed a mini mental state exam on the patient, who scored a 23 out of 30. patient was partially oriented, remembering the year, town, and state, but forgetting the date, day, and season. Although the patient was able to repeat the words red, boy, and car, he was unable to recall the same words after completing a subsequent task. This indicates impairment in short-term memory. The patient's attention span was short, and he continually sought after a different topic of conversation. Graphesphasia and proprioception were all intact. Based on the history of this patient, as a past smoker for 40 years, I would also perform a respiratory exam. I would inspect, palpate, and osculate. According to the Franklin Institute, the primary function of the respiratory system is to supply blood with oxygen in order for the blood to deliver oxygen to all parts of the body. This is a vital assessment to make sure all parts of the lungs are functioning. I would also perform a peripheral vascular exam. Since the patient has Huntington's disease and complains of difficulty moving his legs, it's important to check his pulses and capillary refill. According to the book, Clinical Methods, the history, physical, and laboratory examinations, while examining the pulse, the observer should note its intensity, rate, and rhythm. I would especially take care to check his popliteal, dorsalis pedis, and posterior tibial pulses, and rate them bilaterally on a 5-point scale because of his complaint regarding the feeling in his legs.